Welcome back. Now, Kerala has increased monitoring at various levels in the state as the Nipah cases have risen to 5 at this point in time. A 24-year-old health worker has become the 5th confirmed case of Nipah virus since the recent outbreak. All schools and colleges have been shut. This is in Kozhikode, from where the first outbreak started. A holiday has been declared for all educational institutions for today and tomorrow as well. Meanwhile, a central health ministry team has also held meetings with the district administration. Kerala's health minister, Veena George, has confirmed that the virus strain in the state is the Bangladesh variant, which can spread from human to human with a very high mortality rate. Now, despite being less infectious, the concern, of course, is mortality here. The government has also here authorized the district collector to really issue orders discouraging any sort of mass gatherings in Kozhikode until the 24th of September. Meanwhile, neighbouring Dakshina Kannada district in Karnataka has also sounded an alert, taking precautionary measures after the confirmation of Nipah cases in Kerala. Checkpoints and inspection of goods entering the district have also been implemented, with healthcare facilities in particular on high alert to detect any sort of suspicious cases. Now, let's, in fact, at this point in time, open this up. We have somebody who's been working on the ground, as we said earlier, who's going to be joining us. Dr. Rajeev Jaydevan, who's the co-chairman of the National IMA COVID Task Force of Kerala, is with us. Dr. Rajeev, if you could tell us at this point in time, what's the kind of work that's being done on the ground? If you could take us really through all the preparation that the Kerala Health Department is also doing in this regard.
I'm in touch with people who are investigating the outbreak. I'm not directly at that location, but I can give you a summary of what's going on. As you heard, this has been the 4th outbreak of this particular virus in the state of Kerala. And it started with one gentleman who developed symptoms, and he unfortunately passed away. And then another patient came in who seemed to have similar symptoms, and he also had a morbid outcome. So the doctors who already are aware of the pattern of Nipah, they connected the dots, and they found through detective work that there was an epidemiological link between these two cases. In plain English, it means that they figured out that the second person had acquired or got this virus from the first patient, even though the two people were not related. Through perhaps a conversation that occurred at the hospital. So in Nipah, which is not a natural disease in man, it occurs naturally in bats. It lives peacefully in bats. It doesn't cause a disease because the bat's immune system is specifically adapted to keep this virus in circulation without causing disease. Whereas when the virus finds a human host, the immune system attacks it with all force, and it fails, and the virus finds ways to evade our immune system and enter multiple organs, including the brain and the heart. So the first step is for the virus to enter human beings, which is not a common incident, and then from the infected human being for the virus to jump onto other human beings. Now, in the second part, the virus's ability to jump to other human beings is not as efficient as, for example, COVID or measles. So that, in fact, is a blessing in the sense like this is an extremely lethal virus. If you develop symptoms following an infection, the chance of death is, in fact, quite high, well over 70%. That makes it scary. But the good side, as I mentioned, is the ability of this virus to spread to large numbers of people is severely limited. It's a reproduction number, which is called basic reproduction number.
So how different is the containment measures going to be, Dr. Rajeev? Because you did mention as far as how the COVID variants were, how infectious they were. We don't have that concern with Nipah. So in terms of having containment zones, in terms of identifying who are the people who are in contact with the primary host could be, all of this, is it going to be any different, or are the same protocols as COVID going to be followed here?
The protocols appear to be the same because in this case, there are two separate cases that seem to be linked together, but the two will have separate contact, separate lists of contact, which have come up to more than 700. And there could be other people who could not be tracked. So that is the reason why they go into these containment zones. So just to reduce the chance that anyone might travel out of the area with the virus and then seed the virus elsewhere. But as I said, it is not such a pandemic potential virus as COVID is. There are patients being treated at the hospital. The word is that there is some improvement. A child is still on a ventilator. A 9-year-old boy, he is still on a ventilator. He is a child of the person who passed away. A relative of that person is in apparently stable condition. And a healthcare worker also picked up the virus as expected. It is the close contacts that pick up this virus. It's not people who sit on a train or people who stand on a bus stop that pick up the virus. Someone who's directly taking care of the patient typically picks up the virus, and that occurred with this healthcare worker who is apparently in stable condition.
Okay, and how are the healthcare workers being prepped for this? Because like you mentioned, one of the people who've been tested positive for Nipah is a healthcare worker. Considering the mortality rate, there must be some sort of anxiety among the nurses, especially the people who are working in the hospitals as well. How are they really being prepped, and what is the line of treatment that is being right now prescribed?
As you know, fever is such a common condition. Influenza is so common. COVID comes on and off. So unlike the pre-pandemic setting, now the world is geared towards protective equipment to be worn during work for all healthcare workers. But unfortunately, compliance is never 100%, as you might yourself see when you visit any healthcare facility in the country or elsewhere. So that Kerala is no exception to that. So that's one of the reasons why the healthcare worker got infected in the first place. If you're wearing your protective equipment as is prescribed, you're not going to get infected. But that is not practically possible when there's a lot of people who are coming in and the place is crowded with no ventilation. You don't have enough time between patients to wash your hands. So there are all of these logistical difficulties that stop the healthcare workers from being adequately protected. But a heightened sense of awareness clearly is being brought about, and protocols are firmly being put in place.
Okay, Dr. Rajeev, I quickly want to know, you did mention probably the potential of this being a pandemic level virus is very low, but we're already looking at steps being taken at the borders of Kerala here in Karnataka as well. We are already seeing in Dakshina Kannada the health officials really ensuring that they prepare the healthcare workers, do a little bit of screening as well. So is this something that's required at this stage?
No, it is not. Absolutely not. It's of no value at all, because what are you going to check on a border from a car? What are you going to check in a car? There are lots of people with fever. There are hundreds of thousands of people who have fever and 1 or 2 cases of Nipah. What are you going to figure out on a border? So that's pointless. But what is more important is a detective level tracking using fundamental principles of epidemiology, and the kind of checking you mentioned has no scientific value.
But preparing, the hospitals, preparing the healthcare workers, that would become essential, isn't it, Dr. Rajeev?
Yes. In fact, all healthcare workers require periodic reminders that viruses are around. And unfortunately, healthcare workers are human beings. Memory is sometimes short. They may have seen horrors of the pandemic, but people seem to think that viruses and bacteria have gone away. Tuberculosis is back. All of these infectious diseases can be stopped by wearing protective equipment in the right setting. I mean, you don't have to wear it all the time, but when you're in certain clinical settings, you have to wear your equipment, and that's important.
Okay, Dr. Rajeev, quickly before I let you go, going forward, what will be the plan of action for Kerala in particular right now? Because the cases have gone up to 5. Tracing is one thing that they can do, but at this point in time, there could have been at least 1,000 to 2,000 people who would have been in touch with any of these people who've tested positive. So really, how do they go ahead from here?
Yeah, it's a good question. So I'll quickly answer that in two parts. First is, I hope that with the investigations going on, they will figure out how the first person picked up the virus from a bat, and that still remains a mystery. It is possible that there was some extraordinary interaction that led to the virus jumping from bat to the human being, and we do not know the nature of that interaction. That's number one. On that note, I would strongly caution people from trying to capture bats or trap bats and kill them, because that's a knee-jerk reaction from some quarters around the country and elsewhere. never try to trap or kill bats because bats contain plenty of viruses that could kill you. So do not attempt to handle bats. That's number one. Number two, fruits are safe. Please do not panic and stop consuming fruits or fruit juices. No, unless there are specific instructions in your locality, which is perhaps confined to just this area in India. There is no restriction to eating fruit, but remember to wash your fruit before consuming it. And thirdly, do not ever consume fruit that's lying on the ground, regardless of where you live, because you do not know what kind of organisms are in it, either from the ground or from the animal that was eating it on the tree, whether it's a bat or something else. So never eat half-eaten fruit lying on the ground.
Okay, Dr. Rajeev, here one would also want to know, you did mention in particular fruits are not a concern because that is something that many people were somewhere apprehensive about, and also some types of meat as well. Thanks for clarifying that. But more importantly, I would also want to ask you a question here. There were, tests or kits that were available to test COVID. Now, as far as Nipah as a virus is concerned, if people want to detect it early, if they stand a better chance of survival, how does that happen? Can that happen only at a hospital? Do you see, watch out for any particular symptoms that could be very different from your regular influenza or COVID?
Great question. Now, the diagnosis of Nipah is clinical to start with. You have to suspect it firstly, because as I mentioned, there are thousands of cases of fever. To suspect Nipah, you've got to have a compatible clinical scenario, which, as I described earlier, there has to be some sort of an abnormal or unusual clinical manifestation. For example, somebody with a rapidly progressive breathing difficulty following a bout of fever, becoming disoriented, abnormal behavior, sometimes seizures. Now, these could obviously be a feature of a brain problem, which we call encephalitis, which basically is brain infection. Not all encephalitis is from Nipah, but encephalitis must be taken seriously. And if fever and encephalitis and pneumonia occur together in a setting where there could be encounter with animals such as bats, yes, Nipah could be suspected. And the tests are available at NIV Pune, as well as in regional laboratories. For instance, there's a mobile laboratory being set up in Kozhikode as we speak. That was flagged off today by the health minister. And there is also regional laboratories that are equipped to detect this virus. But for the technicality of it, to declare an outbreak, I believe, if my knowledge is correct, the NIV Pune holds the authority.
Right, Dr. Rajeev, you've been very informative, and for everyone watching, of course, they've got a better understanding, I'm sure, after listening to what you've said. We'll, of course, keep speaking to you through this week as, Kerala fights this virus at this point in time, and people across the country are hoping that they are able to contain it in that limited area and it does not spread. Thank you once again for joining us.